I'm going to talk to you today about osteoporosis. This is a progressive condition of bone thinning. It happens when the two bone cells, the osteoblasts, which build bone, and the osteoclasts, which break bone down, become unbalanced, so you end up in a situation where more bone is being broken down than is being made. This means that the structure of the bones can become thinner and less dense. This happens in a progressive way, so at the beginning there's only mild bone thinning, and we call this osteopenia, and when it gets very severe, this is called osteoporosis. Now, the reason we worry about it is because when your bones become thin, it means if you were to fall over, for example, you trip up a step and you fall onto your arm, you are at a greater likelihood of breaking yourself. Or if you were to have a broken hip from a fall, the reason we worry about osteoporosis is because it increases the likelihood of you having something called a fragility fracture. A fragility fracture is where you break a bone when you've fallen over from your own height. So, for example, if I was to fall over on the floor here, I wouldn't expect to break anything. I'll end up with a bruise and it will hurt, but I wouldn't expect a broken bone. If you have significant bone thinning, then even a very minor trip can lead to a broken bone, either of the hip or the forearm, and another common area is of the spine as well. The reason that people don't know that they have osteoporosis until they break something is because it doesn't cause symptoms whilst it is developing. Our bone density increases throughout childhood and young adulthood. We don't reach our peak bone density until we're about 30. After this, there is a slight drop in testosterone by about 1% a year for men, and sometimes this can lead to osteoporosis for men. But at the time of menopause, there's a steep decline in estrogen, and this is associated with a big increased risk of bone thinning. This means that osteoporosis tends to be more common in women. There are a number of risk factors for osteoporosis. In particular, if you're a lady, the timing of your menopause, for example, if you have a very early menopause, that would mean that you have less estrogen exposure throughout your lifetime. Therefore, you would have increased amount of bone thinning. This is why it's very important for women who have their last period below the age of 45 to consider protecting their bones with a treatment, for example, like HRT. Other risk factors can include drinking more than 2 units of alcohol for women a day, or more than 3 units of alcohol a day if you're a man, smoking, and family history if one of your parents has broken their hip in the past. There are a number of other causes of osteoporosis too, for example, being underweight. People who have a history of anorexia nervosa, for example, are at a greater increased risk of osteoporosis. Other chronic conditions like inflammatory bowel disease or some autoimmune disorders and some cancers can also increase your risk. There are medications as well which increase the likelihood of developing osteoporosis. So in the GP setting, what am I doing to try and assess your risk of osteoporosis? One really important tool is the use of a risk calculation score called FRAX. FRAX is very well studied, and it combines a number of different factors and makes a calculation to say how likely you are to develop a broken bone. And it inputs data such as which country you're from, your age, whether you're male or female, what other lifestyle factors you have, if you smoke or drink alcohol, any other medical conditions you might have, and whether your parent has fallen over and broken their hip. You can use a FRAX score even without having a formal DEXA scan, which is a special kind of X-ray to look at bone density. So FRAX is really handy for giving you an initial idea of the likelihood of osteoporosis. A DEXA scan is the way that you would make the formal diagnosis of osteoporosis. When a DEXA scan is done, various measurements will be taken over the spine and the hips, and this will give you a value called T-score. The T-score is an indication of the bone density. A normal T-score is a reading of above 1 down to minus 0.9. Osteopenia, which is where the bones are a little bit thin, is a value of between minus 1 to minus 2.4. And osteoporosis is diagnosed when the T-score is lower than minus 2.5. So what are the treatment options for osteoporosis? Lifestyle is really critical, and it's very important that you make sure you have enough calcium in your diet. There's a really good calcium calculator on the International Osteoporosis Foundation Society website where you can input what you eat, and it can calculate how much calcium you're having in a day and give you an idea if you're having enough or if you need to increase this. It's also important to have vitamin D as well, and usually you'll be given a supplement or advised to buy some vitamin D. Weight-bearing exercise is critical for maintaining bone density, and I would recommend that everybody is doing this throughout their adult life, whether you've got osteoporosis or not, to protect your bones. Making sure that you stop smoking, that you're not drinking excessively, and that you're eating well to make sure your weight stays stable are all really important things to consider. In terms of other medical management for osteoporosis, we've got the option of HRT, which may be suitable for some women, and also the option of medications like bisphosphonates, which can be taken orally, so by mouth, usually taken on a weekly basis, or this can be given as a yearly infusion. Other treatments which can be started usually in the hospital setting are things like Denosumab, which is a 6-monthly injection. So my take-home message to you is that osteoporosis, whilst invisible, can actually have really significant impact on your health. If you have any concerns about your bone density, or maybe you recognise that you've got some risk factors for osteoporosis, do have a chat with your GP and speak to them about whether you need your bone density checked.